Good evening. Today I'll be informing you on the many versions of healthcare and the consequences of not having healthcare. We have three main healthcare options in Arkansas. Arkansas did expand Medicaid to reach out to adults who are not disabled and other than children and the Social Security Medicaid. Then you also have healthcare.gov, which is for people who would not qualify financially for Medicaid. You also have Medicare, which is for the elderly and the disabled. So first, Medicaid is strictly based on household size and income. There are a few versions of Medicaid, which is the Social Security Medicaid, which covers disabled, also patients with renal failure. And that is handled strictly through the Social Security Administration office. You have this straight Medicaid for adults, which covers everything. There's a little dental and a little vision coverage in those. And you also have interim Medicaid, which does transition into a private option insurance, such as Blue Cross Blue Shield, Qual Choice, or Ambetter. We don't have Qual Choice in our area, so it's just Blue Cross Blue Shield and Ambetter. Like I said, those are strictly based on household size and income. So you'll need proof of income, and DHS handles that. The Department of Human Services does handle the applications and approvals, denials, and just the regulation of that Medicaid, those Medicaid programs. Secondly is healthcare.gov. Healthcare.gov was brought about by the Affordable Care Act, enacted by President Barack Obama. There was a lot of controversy around that. In that act, he mandated that every citizen have health insurance or pay a monetary penalty when taxes are done that next year. So currently, the penalty for not having health insurance at all is $695 per adult and $347.50 per child. And that can go on every year until the mandate is either removed or healthcare coverage is bought. I'm an insurance agent for 3 medical clinics in my county, Cross County. I have licenses held by multiple entities. I have it through the state, through the federal government, and the National Insurers Division. So I do handle insurance every day for work from 8 to 5 every day. I handle every question from just basic, what is this letter? I've walked into my office and had letters sitting on my desk because patients had a question about their insurance and what it covers, what it doesn't cover, and how they can enroll in a different plan. There are open enrollments to all of these except for Medicaid. The healthcare.gov and the Medicare open enrollments kind of fall within each other beginning October 15th through about December 5th or 15th. So we're winding down. Today I'll be discussing the many forms of healthcare and consequences of not having it. So we've already discussed Medicaid. Healthcare.gov, we've touched on that a little bit. The penalty, you can do the application online or by paper or over the phone. Sometimes people just prefer to do it online, and I do help patients with that as well. Medicare is a really complicated process. A patient can have Medicare if they are disabled and have Social Security income unless they're turned 65. 65 is generally the age that people age into Medicare. There are several types of Medicare. Part A is hospital coverage, so that's strictly your labs, your ER visits, any hospital stay you have. Part B is medical coverage, so that covers your doctor's visits, your regular PCP visits. We also have Part C, which is the Advantage Plan. There are multiple insurance companies who have Advantage plans: United Healthcare, Aetna, Blue Cross Blue Shield, WellCare is in our area. Humana also has Advantage plans. And usually Part D, which is the Part D is the drug, is built into Part C. So where one person would have the original Medicare, which would be that Part A and B, they'd have to buy a separate Part D plan. Where if they bought the Part C, which is an Advantage plan, you would have all that and the drug built into it. And it usually does cost a little bit more every month, and that usually comes out of a Social Security check. You can opt out of Part B. Part A is given to you automatically when you turn 65. Part B, you have to buy into, and today's rate for Part B is $134. So if you have grandparents who have Medicare, they generally are paying $134 out of their check every month before they even get a hold of it. It is automatically deducted. The Affordable Care Act is based on household income and size. They have a premium tax credit, which is given to you by the federal government, goes straight to the insurance company to help you pay for those really high premiums every month. That was to kind of mitigate the cost of healthcare out of pocket for the patient. There was a lot of feedback when healthcare.gov was being rolled out that it would just be unaffordable, which totally negates the reason that the Affordable Care Act was brought about, because honestly, every American does deserve health insurance, and it should be affordable. So you can't have insurance. You can't get insurance when your house is on fire. That's what my boss tells me. So it's best to go ahead and get insurance when you're healthy. These people that do not have health insurance and they are incurring bill after bill after bill, they are the ones who are driving up the costs of healthcare, other than greed from the hospitals and pharmaceutical companies, of course. So we've talked about the Affordable Care Act, Medicare, and Arkansas's expansion of Medicaid. For each of these, you can do paper applications, you can do online applications, or by phone. So if any of you are turning 18, you really need to think about what you're going to do for healthcare coverage. It's best to have it and not need it than to need it and not have it.